Hi, doctors. How are you? Today we are going to discuss one very important topic called tyrosine kinase inhibitors and other small molecule inhibitors. In that, first we are going for discussion of tyrosine kinase inhibitors. When I say tyrosine kinase inhibitor, there are some drugs acting against growth factor receptors. When I say growth factor receptor, you should know there is something called epidermal growth factor receptor. It is also called as HER, human epidermal growth factor receptor 1. So, EGFR is also called as HER1 receptor. There is another important growth factor called VGFR. VGFR means vascular growth factor receptor. One more thing, PDGFR. PDGFR means platelet derived growth factor receptor. So, when you say a drug is a tyrosine kinase inhibitor, it may be either EGFR blocker or VGFR blocker or PDGFR blocker. So, first thing I go one by topic. What are all the tyrosine kinase inhibitor that are selectively blocking EGFR, the so-called HER1 receptor? The drug names are gefitinib, erlotinib, afatinib, osimertinib, and latest one dacomitinib. Remember, all the tyrosine kinase enzyme inhibitor name and all ending with a suffix called nib, NIB. For example, gefitinib, erlotinib. Like that, the name will be ending with a suffix called NIB. The first MC question, all these EGFR blocking tyrosine kinase inhibitors are approved for treatment of metastatic non-small cell lung cancer. In that one very important question, we have one drug called erlotinib. We know erlotinib useful for non-small cell lung cancer, but you should know erlotinib in addition to non-small cell lung cancer, it is also useful for pancreatic cancer. That means the question will be find out which one of the following tyrosine kinase inhibitor useful for pancreatic cancer mean think of erlotinib. This is very important MC question. But actually speaking, the drug of choice for pancreatic cancer is we have one drug called gemcitabine. Gemcitabine actually anti-metabolite. That is the drug of choice for pancreatic cancer. So be clear. If they are asking which is the tyrosine kinase inhibitor useful for pancreatic cancer mean, then you should go for erlotinib. Again, one more question. The erlotinib causes problem in the eyelashes. Look at the eyelashes. There is a abnormality in the eyelashes. The color and the texture getting altered. It is called dysmorphic eyelashes. There is one thing called image based question for your NEET paper. If they put this image and asking this is a photograph, it's a problem caused by one anti-cancer drug. Find out the drug mean think of erlotinib. So question, erlotinib causes dysmorphic eyelashes. Now, after EGFR blocker, now we are going for discussion of there are some tyrosine kinase inhibitor blocking VGFR, that is vascular growth factor receptor. So what are the example for VGFR blocking tyrosine kinase inhibitor? First you should know drug name. The drug names are sorafenib, sunitinib and lenvatinib. In that sorafenib useful for renal cell cancer or CC and also useful for HCC, that means hepatocellular carcinoma. Remember, sorafenib, it is the drug of choice for hepatocellular cancer. It's a very important MC question. Then sunitinib, a VGFR blocker useful for RCC, that is renal cell cancer, and also useful for GIST, G-I-S-T. GIST mean gastrointestinal stromal cell tumor, and sunitinib also useful for pancreatic cancer. Then we have one drug called lenvatinib. Lenvatinib useful for thyroid cancer as well as useful for renal cell cancer. So you should know what are all the VGFR blocker name. Then very important next MCQ question. Tyrosine kinase inhibitor blocking PDGFR, that is platelet derived growth factor receptor. Here there are two important drugs. One is called imatinib. Imatinib. One more drug called latest one AVA. Avapritinib. Both are PDGFR blocking tyrosine kinase enzyme inhibitor. Here imatinib, a wonderful drug useful for treatment of chronic myeloid leukemia, and it's also useful for GIST. Similarly, avapritinib, a newer tyrosine kinase inhibitor useful for GIST. In this slide, I go for extra point. First extra point, what about CML, chronic myeloid leukemia. We know chronic myeloid leukemia is a problem caused by translocation of chromosome called BCR-ABL oncogenic, causing chronic myeloid leukemia. For this case, there are some tyrosine kinase inhibitor useful. The drug of choice, MCQ, the drug of choice for CML is imatinib. Very important. Imatinib is the first generation tyrosine kinase enzyme inhibitor. That is the first line drug of choice for CML. But imatinib nowadays developing resistant. So if the CML resistant to imatinib mean in that case we have some more newer tyrosine kinase inhibitor. They call second generation tyrosine kinase inhibitor, namely dasatinib, nilotinib and bosutinib. All these drugs are second generation tyrosine kinase inhibitor useful for imatinib resistant CML. Suppose if the CML resistant to these drugs mean, then we have still more newer drug. They called as third generation tyrosine kinase inhibitor, namely radotinib, ponatinib and bafitinib. They call third generation tyrosine kinase enzyme inhibitor. So MCQ may be find out which one of the following is the second generation tyrosine kinase inhibitor useful for CML, or which one is third generation. Like that question may be prepared. So you should know currently for CML the drug of choice is imatinib. Extra one more point. If the CML resistant to more than 2 or 3 tyrosine kinase enzyme blocker mean, in that case we have using one new drug called omacitoxin. So omacitoxin, a latest drug useful for treatment of CML which is resistant to more than 2 to 3 tyrosine kinase enzyme inhibitor. So what we done in this slide is there are some drugs useful for CML we discussed. Similarly, I want to discuss one more point. What are the tyrosine kinase enzyme blocker useful for GIST? This is also one area for MCQ. So in my next slide, I am going to discuss tyrosine kinase enzyme inhibitor useful for GIST. I think you know GIST mean gastrointestinal stromal cell tumor. In that first choice imatinib. The first line choice imatinib. Look here, imatinib in case of GIST targeting against c-KIT. So the target of imatinib in case of GIST is c-KIT. Suppose the c-KIT undergo alteration or mutation mean in that case imatinib may be developing resistance. So for the treatment of imatinib resistant GIST we are using newer drug called sunitinib. So the next drug is sunitinib. Other than imatinib and sunitinib, we have some more newer drug useful for GIST. They includes one is called REGOR, regorafenib. one new drug. One more latest drug is avapritinib. All these are tyrosine kinase enzyme inhibitor useful for treatment of gastrointestinal stromal cell tumor. So, doctor, what we so far discussed is there are some tyrosine kinase inhibitor targeting against EGFR, some are targeting against VGFR, some are targeting against PDGFR. Now, what we are going to discuss is multi-targeted tyrosine kinase inhibitor. Multi-target. That means there are some tyrosine kinase inhibitor targeting against more than one receptor. For example, there is one thing called tyrosine kinase inhibitor targeting against EGFR. We know EGFR is also called HER1, and the same drug also targeting against HER2. That means a tyrosine kinase inhibitor targeting against both HER1 and HER2 positive breast cancer. Mean think of lapatinib. Very important MC question. A tyrosine kinase inhibitor useful for treatment of HER1 and HER2 positive breast cancer. Mean think of lapatinib. And one more newer drug we have, that drug is called NERA, niratinib. Niratinib is a tyrosine kinase enzyme blocker useful for treatment of HER1, HER2 as well as HER4 receptor positive breast cancer. So remember, what are the tyrosine kinase enzyme blocker useful for breast cancer? Mean think of lapatinib and one more drug called niratinib. Now I got some more multi-targeted tyrosine kinase enzyme blocker. For example, there are some tyrosine kinase inhibitor targeting against EGFR plus VGFR. The drugs are vandetanib, cabozantinib. These two drugs are targeting against EGFR as well as VGFR, and they are useful for treatment of medullary cancer of thyroid called multi. And then another very important topic, there are some tyrosine kinase inhibitor targeting against both VGFR plus PDGFR. The drugs are axitinib and pazopanib. So axitinib and pazopanib are multi-targeted tyrosine kinase inhibitor useful for RCC, the so-called renal cell carcinoma. In that, I want to give one summary point. The point is, what are all the tyrosine kinase inhibitor useful for RCC? That includes sorafenib, sunitinib, lenvatinib, axitinib and pazopanib. Remember, in this axitinib and pazopanib are targeting against both VGFR and PDGFR. That finishes some important multi-targeted tyrosine kinase enzyme inhibitor. And then we have one special type of tyrosine kinase inhibitor called Bruton tyrosine kinase inhibitor. What are the examples for Bruton tyrosine kinase inhibitor? Examples are ibrutinib, acalabrutinib and zanubrutinib. Look at the spelling. We know nib. Nib means those drug name ending with the nib mean tyrosine kinase inhibitor. Here brut, B-R-U-T, brut, that means Bruton tyrosine kinase inhibitor. They are all very much useful for treatment of mantle cell lymphoma and chronic lymphoid leukemia and also Waldenstrom macroglobulinemia. They are called Bruton tyrosine kinase enzyme inhibitor. Remember one general point, doctor. Most of the tyrosine kinase enzyme blockers are administered orally. So, since given orally, the common side effect will be GI toxicity like nausea, vomiting and diarrhea. In addition to nausea, vomiting, diarrhea, Any drug blocking VGFR mean that drug will cause extra problem like hypertension. That finishes some general aspects of tyrosine kinase inhibitors. Hi. In this video, we are going to discuss small molecule inhibitors. In that first, we are going to discuss anaplastic lymphoma kinase inhibitors. These are a newer group of drugs useful for treatment of non-small cell lung cancer. There are three generations of anaplastic lymphoma kinase inhibitors we having. The first generation drug name is CRIZO, crizotinib. Second generation drugs are ceritinib, brigatinib, alectinib. And the third generation anaplastic lymphoma kinase inhibitor name is lorlatinib. All these drugs are useful for treatment of non-small cell lung cancer. Next, a very important topic, mitogen activated protein kinase inhibitor. For this, first we discuss mitogen activated protein kinase pathway. For example, stimulation of the tyrosine kinase receptor causes activation of RAS. That in turn activate BRAF. That in turn stimulate MEK1 and 2, and activation of MEK1 and 2 causes activation of ERK1 and 2. That in turn causes gene transcription and cellular proliferation. It's one of the most important pathogenesis involved in malignant melanoma. So, mitogen activated protein kinase pathway involved in pathogenesis of malignant melanoma. So, to attack this, we have some drug. One group of drug is targeting against BRAF. They call BRAF inhibitor called vemurafenib, dabrafenib, on one more newer drug, encorafenib. All these three drugs are acting against BRAF and useful for V600E mutation involved malignant melanoma cancer. So, vemurafenib, dabrafenib, encorafenib are BRAF blocker useful for treatment of malignant melanoma. There is one more group of drug targeting against MEK. They call MEK1 and 2 inhibitors called tramatinib, gobimetinib, and one new drug called binimetinib. These three drugs are MEK1 and 2 inhibitor useful for treatment of malignant melanoma. So you should know mitogen activated protein kinase blocker mean two class of drug, BRAF blocker and MEK blocker. All these are useful for treatment of malignant melanoma, one important topic. Another important small molecule inhibitor category, FMS like tyrosine kinase 3 inhibitor, they call FLT3. FLT, that is FMS like tyrosine kinase 3 inhibitor. Drug names are midostaurin, one more drug, gilteritinib. In this, the midostaurin useful for treatment of AML, mastocytosis, and also useful for mast cell leukemia. Whereas the newer drug, gilteritinib, useful for treatment of AML. So we should know midostaurin and gilteritinib are FMS like TK3 inhibitors. Next, phosphoinositide 3 kinase inhibitor, simply called PI3K. PI, that is phosphoinositide 3 kinase inhibitor. These drug name and all ending with the suffix SIB, ZIB, for example, IDEL, idilalizib, DUVLI, duvilizib, and COPAN, copanlisib. All these drugs names ending with a suffix called SIB. They call PI3 kinase inhibitor, useful for treatment of CLL, non-Hodgkin's lymphoma, and also useful for small lymphocytic lymphoma. The next important spleen tyrosine kinase inhibitor, a drug called fostamatinib. Fostamatinib. This is useful for treatment of immune thrombocytopenia purpura. It is called spleen tyrosine kinase inhibitor. Then tropomyosin receptor kinase called TRK inhibitor. TRK means tropomyosin receptor kinase inhibitor. Drug name larotrectinib. Larotrectinib useful for treatment of solid tumor in children and adults caused by neurotropic receptor kinase called TRK inhibitor. Next is very important, fibroblast growth factor receptor kinase inhibitor, simply called FGFR. That is fibroblast growth factor receptor kinase inhibitor. Drug name erdafitinib. The erdafitinib useful for treatment of urothelial cancer. And then CDK, very important. CDK stands for cyclin dependent kinase. So we have some cyclin dependent kinase 4,6 inhibitor useful for treatment of breast cancer. The drug names are palbociclib, abemaciclib, ribociclib. These drugs names are all ending with clib, C-L-I-B, clib. Palbociclib, abemaciclib, ribociclib, useful for treatment of breast cancer. They call cyclin dependent kinase 4,6 inhibitor. Then proteasome inhibitor, very important. Drug names are bortezomib, carfilzomib, and latest one called IXA, ixazomib. Look at all these drug names ending with mib, bortezomib, carfilzomib. These are proteasome inhibitor useful for treatment of multiple myeloma. So currently for treating multiple myeloma, the first line drug of choice is bortezomib. It is the proteasome inhibitor. And the important adverse effect of bortezomib includes thrombocytopenia, peripheral neuropathy, and also fatigue, tiredness. All these are important adverse effect of bortezomib, a proteasome inhibitor. That's a drug of choice for multiple myeloma. Next, poly-ADP ribose polymerase inhibitor. They call simply PARP inhibitor, PARP, PARP blocker. PA, that is poly-ADP, RP, ribose polymerase inhibitor, PARP blocker. There are some drugs useful for ovarian cancer. For example, olaparib, niraparib, rucaparib. Look at the spelling, doctor. All the drug name ending with parib, PARAP. That is poly-ADP ribose polymerase inhibitor called PARB. Olaparib, niraparib, rucaparib useful for treatment of ovarian cancer. So question will be find out the PARP inhibitor useful for ovarian cancer. Mean think of these drugs. And we have one latest drug called TALA, talazoparib is a newer PARP inhibitor useful for treatment of breast cancer. So there are some PARP blocker useful for treatment of ovarian cancer and talazoparib useful for breast cancer. So remember PARP inhibitor. Another latest important small molecule inhibitor, Hedgehog signaling pathway inhibitor. Look at the drug name. The drug names are Vismodegib and Sonidegib. Look at the spelling. These drug name and all ending with a suffix called GIB, GIB. Vismodegib, Sonidegib. They call Hedgehog signaling pathway inhibitor, and they are useful for treatment of adult patient with basal cell carcinoma. So Vismodegib, Sonidegib useful for treatment of adult patient with basal cell carcinoma. And we have one more new drug called GLA, Glasdegib. It's a newer hedgehog signaling pathway inhibitor useful for treatment of AML. So you should know hedgehog signaling blocker. Another very important small molecule inhibitor called Janus kinase inhibitor. Very important area. Janus kinase inhibitor. Here we have one drug called UPA, upadacitinib. It's a Janus kinase 1 inhibitor. This drug useful for treatment of rheumatoid arthritis, Crohn's disease, ulcerative colitis, atopic dermatitis, and psoriatic arthritis. Drug name upadacitinib. It is a Janus kinase 1 inhibitor. Whereas we have one drug called BARI, baricitinib. Baricitinib is a Janus kinase 1 and 2 inhibitor. This drug is useful for treatment of polycythemia as well as rheumatoid arthritis. Drug name baricitinib. Another drug called RUXO, ruxolitinib. The ruxolitinib is a Janus kinase 1 and 2 inhibitor useful for treatment of myelofibrosis. Another very important drug called tofacitinib. The tofacitinib is a Janus kinase 1 and 3 inhibitor useful for treatment of rheumatoid arthritis. So you should know what are all the Janus kinase inhibitor and what are the indication. All these are very important area for MCQs. And then we have one more small molecule inhibitor group called histone deacetylase inhibitor called HDA. Histone deacetylase called HDA inhibitor. The drug names are orinostat and romidepsin. The orinostat romidepsins are histone deacetylase inhibitor useful for treatment of cutaneous T-cell lymphoma. Cutaneous T-cell lymphoma, also called mycosis fungoidosis, also called as Sézary syndrome. That means find out the histone deacetylase inhibitor useful for treating cutaneous T-cell lymphoma. Think of orinostat and romidepsin. Another latest histone deacetylase inhibitor name is panobinostat. The panobinostat useful for treatment of multiple myeloma. So question, find out the histone deacetylase inhibitor useful for treating multiple myeloma. Think of panobinostat. And then we have one latest drug called BELI, belinostat. It is also a histone deacetylase inhibitor useful for treatment of peripheral T-cell lymphoma. Drug name is belinostat. Next is B-cell lymphoma 2 protein inhibitor, simply called BCL2 protein inhibitor. First, we should know drug name. The example for this category drug is venetoclax. What is the mechanism action of venetoclax? Venetoclax blocks the anti-apoptotic B-cell lymphoma 2 protein, thereby leading to programmed cell death of CLL cells. So, the venetoclax, a newer drug useful for treatment of CLL. It's called BCL2 protein inhibitor. Another one more important small molecule inhibitor is isocitrate dehydrogenase 2 inhibitor, simply called IDH2 inhibitor. Example for this group of drug is enacidenib, one more drug IVO, evocidinib. These two drugs are IDH2 inhibitor useful for AML. So what we've done so far is we discussed so many important small molecule inhibitors. Very important topic. Read well. Thank you.